Chapter 5 Sample Receipt. Topic Accessioning. At the end of this chapter, learners should be able to describe the process for receiving the samples from OPDs, wards, and referral, how to act on missing or compromised samples, the acceptance and rejection criteria of the samples, and specimen preparation before testing. What do we mean by accessioning in the laboratory? The act of logging or documenting the demographics and the receipt of specimen in the laboratory is known as accessioning. Many large laboratories have an accessioning area where samples are received, processed, logged, and assigned an identifier before being distributed for analysis. Samples are typically logged into the laboratory information system, which is the database for the laboratory to access for the samples received at the center. The data elements required for laboratory information system are date of sample receipt, patient details, laboratory reference number and patient unique ID, the test requested for, billing details and patient contact details. In resource limited settings, accessioning can be done by manual entry into registers of the important details required at accessioning. The equipment required at the accessioning or sample receipt desk are laboratory register book, fine tip markers, gloves, pens black and red, laboratory coat, disinfectant, accessioning register or computer for accessioning, sample racks, rejection forms, and documentation procedures, for example, reconciliation forms or register for outside samples. Accessioning in-house samples. The laboratory procedure for sample reception should follow standard essential steps. There should be a dedicated area for sample accessioning. All samples should be accompanied with test request forms, electronic or paper. Samples should be unequivocally traceable by request and labeling to an identified client by unique identification number and laboratory number. All samples received should be recorded in relevant registers. The date and time of receipt and or registration of samples should be recorded in the respective register. Authorized laboratory technicians or counselors evaluate the received samples to ensure that they meet the sample acceptance criteria relevant for the requested test. Sample rejection criteria should be followed by laboratory staff. All the specimens should be treated equally except for physician requested urgent specimen or in case of needle stick injury. Department-wise checklists may be generated for biochemistry, hematology, clinical pathology, serology, microbiology, histopathology, and cytology, and specimen referrals. The samples are to be separated department-wise, centrifuged or processed as per protocol and delivered to the respective departments. Accessioning procedure for samples received from outside. All samples should be accompanied with test request forms. The samples must be shipped to the laboratory under conditions that are appropriate for subsequent processing, culture, and testing. Unpack the patient samples and the requisition forms. Match each sample with the corresponding request form and make sure that the identifiers on the sample containers match those on the test request form. If there is an inconsistency between the sample label and the request form, a procedure should be available in the laboratory to deal with these discrepancies. A reconciliation form is suggested. Copies of the request and reconciliation form should be archived. The date and the time that the samples were received at the laboratory and the initials of the personnel handling the samples, sample appearance and volume are noted on the lab test request form. Record the sample laboratory number and the patient's information in the laboratory register book in which subsequent monitoring will be done. Thus, accessioning needs to be done following standard protocol for all in-house samples and samples received from outside.